I know. Well, Botox has been used for, curing fine lines and wrinkles, but now it's helping cure migraines. We're going to tell you how coming up on the Fox 5 Morning News.
Okay, we are now checking in once again with Miss Heather Ford, live at Encinitas at Scripps Memorial Hospital.
Hey, Heather.
Hey, good morning to both of you. So we're talking about a very effective treatment to help with chronic migraines. I want to give you just a quick warning, though, because we are doing some medical procedures here, and our neurologist on hand is going to show us a little bit about this. Now, a question that we have, too, is possible side effects that could be with these treatments. We're talking about using Botox, which the FDA has approved to treat migraines. So what are some possible side effects that people could have?
Some patients on the day that we inject can get a headache on that exact day. Some patients will get a droopy eyebrow or even a little bit of neck weakness and neck discomfort. But generally these side effects are mild and transient. They don't last for very long. Within a week or two, patients are generally feeling better if they get that side effect. But the headache effect lasts about 12 weeks, and then they need to be re-injected each time. We do modify our injections to accommodate to make sure they don't get side effects.
And the injection sites, which we're going to show right now, are much different from if you were going to get the injections at a dermatologist office, where you would get them for wrinkles. This is interesting because you're putting Botox into her shoulders and her head and things like that. Why would you do this? Is this where the nerves are, and how does this work?
That's correct. These are nerve points, and we're injecting around these sites really to have effects on the brain tissue. These nerve endings feed into the brain stem, and our Botox is going to dampen down that activity. So we're not doing this to have a muscle effect where we're weakening muscles, but rather we're blocking nerve impulses to the brain.
Now, I think what a lot of people wouldn't know, this is actually your work. I mean, you've figured all this out. How did you come to these conclusions?
So this is work that's been done by multiple physicians over many years. This first started in the 90s, initially as a cosmetic treatment, and then it evolved into a headache treatment. And after treating many thousands of patients, we've worked out the exact sites that you need to do in order to get the good effects. So if this is not injected in exactly the right locations, we don't get the same effects for headache, and we might get more side effects.
So how many patients are you working on per day? How popular is this?
At the moment, I'm injecting about 10 patients a day with chronic migraine. It's not that this is popular, it's just that our center specializes in this type of treatment. It's a treatment that we train other physicians on all over the country and even around the world.
And then not only that, you're finding that Botox is helping with other disorders besides just migraines. Could you touch on those really quick?
Well, Botox has been used for multiple medical problems. It's been used to treat overactive bladder. It's also used to treat excessive spasticity after a stroke. And it can also be injected for patients who have excessive sweating.
Okay. Before we go, I just want to talk to Holly really quick, because both of you are patients here. And if you get treated every 3 months, what have you felt so far? What's a little testimony from you, I guess, of how this has worked for you?
We used to get it. I used to get migraines at least a couple times a week, and now it kind of takes a while for it to start working. It takes at least 2 weeks once you get the injections and stuff, but over a period of time of getting it in a year, it usually starts to really decrease the amount of migraines that you get.
Okay, so that works a lot. All right, thank you so much. Very interesting stuff. And for now, I guess I'm going to send it back to you guys in the studio.
And Heather, maybe you mentioned it, and I just missed it. Can you talk a little bit about how much this is going to cost if people get this treatment? Maybe you can ask the doctor. And I know it depends on different insurance plans, right?
Right. So it would depend on the insurance plan. And doctor, you could kind of cite to this. It could be an expensive thing, but the newest, I guess, step in this is all that the insurance plans are starting to pay for this. I'm sure it's quite a process, but how expensive could this be?
So this is a treatment designed specifically for patients who have frequent migraine, who've often tried lots of other treatments and haven't had success. They're very disabled patients. And under those circumstances, we're able to get the insurance companies to pay for it. Not all the insurance companies are doing that, but a large number of them are starting to do it because the medication was approved last year in October by the FDA, and so that's changed a lot of the policies. Now, if a patient was to have to pay cash, because we use very large doses, much larger doses than are used in a cosmetic setting, the cost is very high. So you could be spending over $1,000 just in medication costs if you were paying cash.
Okay. Thank you so much, doctor.
Thank you.
Erica, back to you.
All right, thank you, Heather. We appreciate it.